Hello बच्चों and welcome once again to the clinical anatomy case discussion of the lower limb. हमने ये lower limb का case discussion चालू किया है specially for you. 4 clinical cases we have already discussed and now we come to the 5th clinical case for you. Okay, चलो let us start. After an adductor canal block for knee surgery, अब knee surgery चल रही है, adductor canal में anesthesia दिया है to block the nerves during knee surgery. A patient has numbness over the medial leg and the foot. Okay, so before going to anything, adductor canal block दिया है, तो let us understand the boundaries of adductor canal. Adductor canal block है, so let us first understand the boundaries and the contents of adductor canal. जब आपको contents of adductor canal पता होगा, तब you will be able to answer this MCQ, right? Because it's an adductor canal block. Okay, so what is the boundary of adductor canal? Have a look at this. So ये ना मैंने femur draw किया, हाँ? This is the femur. If I draw this as the femur, if you can tell me what are these muscles here? ये कौन से muscles हैं? ये and this. ये क्या है? This is the medial side. So ये vastus medialis हो गया, ये vastus lateralis, that's a vastus intermedius, and that's a rectus femoris. So vastus medialis, vastus lateralis, vastus intermedius, and rectus femoris. What are these muscles below? नीचे कौन से muscles होंगे? दो muscles हैं. One is the adductor longus, and थोड़ा सा और नीचे जाओगे तो adductor longus and adductor magnus. So upper boundary or the superior boundary is formed by vastus medialis. The inferior boundary is formed by the adductor longus in the upper part. ऐसे लिखते हैं upper part, and adductor magnus in the lower part. So it will be clear. Adductor magnus in the lower part. Fine. And the roof is formed by what? The roof is formed by the sartorius. ये कौन है? Sartorius. So ये बन गया अपना adductor canal. So adductor canal के boundaries, so superior boundary vastus medialis. What's the inferior boundary? Adductor longus, adductor magnus. So I'll write it down here as adductor longus, adductor magnus, and that's a sartorius. Fine. ये बन गया अपना adductor canal. अब इसके contents देखिए, contents क्या होगा? Femoral artery, femoral vein. हाँ, तो ये तो main contents हो गए, femoral artery, femoral vein. Then there's a nerve to vastus medialis. There's a posterior division of obturator nerve, and there's one more saphenous nerve. चलो इसे label करते हैं. This is 1, this is 2, this is 3, and this is 4. So who's 1? कहाँ पे लिखूँ मैं? हाँ, चलो यहाँ लिख देते हैं. 1 is the femoral vessels. एक है femoral vessels, artery and vein. Who's 2? 2 is the nerve to vastus medialis. 3 is the posterior division of obturator nerve. 4 is saphenous nerve. ठीक है. So number 1 are the femoral vessels, number 2 is the nerve to vastus medialis, 3 is the posterior division of obturator nerve, and 4th is the saphenous nerve. So ये बन गए contents of adductor canal. Fine है. इसमें number 2 is muscular, posterior division of obturator nerve, ये भी muscular है, femoral vessels हो गए. Who's the cutaneous nerve? That's the saphenous nerve. The saphenous nerve crosses the femoral artery from the lateral to the medial side. Lateral से medial side को cross करती है femoral artery को. Like suppose if that's the femoral triangle, ये sartorius है, ये adductor longus है, ठीक है? This is the femoral triangle. This is the femoral artery. ये femoral artery है. The femoral nerve, ये है femoral nerve, and this is the saphenous nerve. ये कौन है? Saphenous nerve. So saphenous nerve crosses the femoral artery from the lateral to the medial side. फिर यहाँ पे what is this now? इसके नीचे होता है adductor canal. Femoral triangle जहाँ पे end होता है, this is the adductor canal. ये बनता है adductor canal. So the saphenous nerve crosses the femoral artery from the lateral to medial side. फिर ये adductor canal में आती है. Then it pierces the roof of the adductor canal. Saphenous nerve pierces the roof of the adductor canal and becomes cutaneous. ये cutaneous बन जाती है. It supplies the skin on the medial aspect of the leg and the foot. supplies the skin on the medial aspect of the leg and the foot. अब clear है बच्चों? मतलब this concept has to be there in your mind before you answer the clinical question. तो पहले तो हमने देखा एडक्टर कैनाल, हमने कंटेंट्स ऑफ एडक्टर कैनाल देखा, हमने आइडेंटिफाई किया हु इज द क्यूटेनियस नर्व इन दिस, how this saphenous nerve crosses the femoral artery from the lateral to medial side, ये हमने जान लिया. This saphenous nerve is a cutaneous nerve. It pierces the roof of adductor canal. ये क्या supply करती है? The skin on the medial aspect of the leg and the foot. Medial aspect of the leg and the foot. Fine. Okay. With this concept, now just try to understand this. So adductor canal nerve block दिया है, ठीक है? For a knee surgery, patient has numbness on the medial leg and the foot. अब clear है? So medial leg and foot दिया है, मतलब which is the nerve injured or which is the nerve affected? Saphenous nerve. Numbness है, मतलब cutaneous है, cutaneous. But the quadriceps power is largely preserved. अब quadriceps को कौन सप्लाई करता है? Quadriceps को सप्लाई करता है the main femoral nerve. The femoral nerve का posterior division is going to supply the quadriceps femoris. Femoral nerve का posterior division. So quadriceps power is intact. मतलब femoral nerve का cutaneous branch is affected, saphenous nerve. Which is the nerve targeted? बोल सकते हो आप, which is the nerve targeted? That's a saphenous nerve. Saphenous nerve, and that's a cutaneous branch of femoral nerve. Cutaneous branch from the posterior division of femoral nerve. Where does it run in the canal? Relative to femoral artery. It crosses the artery from lateral to medial side. Lateral से medial side पे cross करती है. Femoral triangle में, फिर adductor canal में it is again crossing towards the medial side. And then वो roof को pierce करती है. Why does it not produce foot drop? A foot drop is due to injury to which nerve? Foot drop is due to injury to the common peroneal nerve. Common peroneal nerve. Common peroneal nerve is a branch of sciatic nerve. Common peroneal nerve is a branch of sciatic nerve. ठीक है ना? And sciatic nerve अगर injury होती है या common peroneal nerve injury होती है तो foot drop होता है. So we are not concerned with common peroneal nerve and the sciatic nerve. Femoral nerve आगे है, sciatic nerve पीछे है. You understanding? Anterior compartment of thigh में कौन है? Femoral nerve. Sciatic nerve पीछे की तरफ है. It's in the posterior compartment. State the nerve supply of the foot. ये मैं बोलता हूँ. I'll tell you. बच्चों clear है? So numbness along the medial aspect of the leg and the foot. Nerve involved is saphenous nerve. It's a branch of posterior division of femoral nerve. Crosses the femoral artery from the lateral to medial side in the femoral triangle and the adductor canal. Okay, nerve supply of the foot, plantar aspect of the foot बोल देता हूँ. The nerve supply of the plantar aspect of the foot. एक बार देख लो. Look, this is the foot. Plantar aspect है, plantar aspect. Sole of the foot है, sole. So who supplies the skin on the medial aspect of the foot up to the great toe? Up to the great toe, यह है saphenous nerve. So medial aspect of the foot up to the great toe, that's saphenous nerve. Who supplies the skin on the medial aspect of the great toe? That's a superficial peroneal nerve. Superficial peroneal nerve supplies the skin on the medial aspect of the great toe. All the web spaces are supplied by superficial peroneal nerve. All the web spaces are supplied by superficial peroneal nerve. The first web space, this is supplied by what? Deep peroneal nerve. The first web space is supplied by deep peroneal nerve. The lateral aspect of the foot is supplied by whom? Sural nerve. Sural nerve. So lateral aspect is supplied by sural nerve. The medial aspect of the foot up to the great toe is saphenous nerve. Medial aspect of the great toe, all the web spaces except the first web space, that is superficial peroneal. First web space जहाँ पे अपन slippers पहनते हैं ना, that is supplied by deep peroneal nerve. Deep peroneal nerve. The heel, ये जो heel देख रहे हो, that is supplied by tibial nerve. Tibial nerve. And now 3.5 and 1.5 fingers. 3.5 fingers is supplied by medial plantar nerve. Medial plantar nerve. And 1.5 fingers is supplied by lateral plantar nerve. Lateral plantar nerve. मतलब ये sole of the foot है. Medial plantar nerve supplies 3.5 fingers on the sole of the foot. Lateral plantar nerve supplies 1.5 fingers on the sole of the foot. ये medial and lateral plantar किसके branches होते हैं? Tibial nerve के branches होते हैं. These are the branches of tibial nerve. So this is the nerve supply of the foot. Very very important, बहुत ज़्यादा important है बच्चों. क्लियर है ये adductor canal हो गया, उसके contents हो गए, everything we have discussed. ठीक है, एक MCQ वापस बच्चों, specially for you. MCQ. The nerve that traverses the adductor canal and supplies the cutaneous supply to the medial aspect of the leg and the foot is, come on, you should be able to answer this. एक बार ये concept clear हो गया, ऐसे कंसेप्ट बिल्ड करिए बच्चों. बिल्ड द कंसेप्ट लाइक दिस एंड बी वेरी क्लियर. एक बार ये कंसेप्ट क्लियर होता है, यू विल गेट कॉन्फिडेंस, यू विल बी एबल टू आंसर द क्लिनिकल केसेस एंड द एमसीक्यूज.